announcement that we have today. We should have some music and festivity. But thank you all so much for joining us this afternoon at Metro Hall for an incredibly important update. An important update on our efforts collectively to make our city safer, to make our city stronger, to make our city healthier, to address our team's unwavering commitment to address some of the most urgent and challenging and complicated challenges that we face together. And those are those that are related to behavioral health. I'm proud today to introduce a wonderful person who you'll hear from momentarily, Dr. Maria Lederman. She is our new Executive Director of Behavioral Health for the city of Louisville. This is a new leadership role that I've established in creating a new Office of Behavioral Health in the mayor's office. Dr. Lederman is dedicated to advancing our strategy, aligning our services, and ensuring that our city has the infrastructure and systems that our community deserves. We know that behavioral health intersects with every aspect of a healthier and safer community, from housing and employment to education and public safety. Yet for far too long, we, like many other places around our country, have viewed behavioral health, substance abuse, homelessness, and even crime as separate and distinct issues. Yet all of us here today know that these challenges are deeply intertwined with one another. And if we're serious about ending homelessness for our most vulnerable community members, if we're serious about reducing public safety, then we must prioritize behavioral health services and get that to more people in need. Integrating behavioral health allows us to begin closing gaps that too often leave people behind. This new office will work across Louisville Metro government with multiple departments that are already working on related initiatives to help improve their results for the people who we all serve together. Instead of temporary solutions that lead to shelter stays, emergency room visits, arrests, or even jail, and then back on the street once again, we're aiming for long-term solutions. Most importantly, stability, opportunity, new pathways in life for our neighbors. This is groundbreaking work. We're not aware of any other city, I'm not aware of any other mayor that has elevated behavioral health to this level within a city government. Dr. Lederman will serve with a clear mission to coordinate across city agencies with nonprofit partners like many of you here today and community treatment providers. So please join me in welcoming our new Executive Director of Behavioral Health, Dr. Lederman, to share a few words about her next steps. Maria?
Wow, this is incredibly exciting. Thank you all for being here. I would like to thank you, Mayor Greenberg, for your faith in me and appointment as the city's very first Executive Director of Behavioral Health. As a psychologist, as a public servant, as a member of this community, I'm humbled by the trust that you have placed in me to lead this great work. And more importantly, beyond my personal appointment, I want to thank you on behalf of the city for placing this work where it belongs, which is front and center. You are sending a very clear message to our city about what your priorities are and what we're going to be focusing on together as a city. And this truly demonstrates what investment is in the people in the community that we are all serving. As I step into my new role, I think it's important to share a little bit about my journey and where I've gotten to be in this position today. So originally when I started my clinical training, I knew that I wanted to be a forensic psychologist, and I knew that I wanted to work across the criminal justice system. What does that actually mean? That involved an untraditional and interesting journey. As I started my clinical training and doing my professional work, I was placed at a lot of different sites, including at-risk high schools, working in prisons, working in psychiatric facilities. As I was in these settings, I was constantly serving populations that we were identifying as being the highest needs or having the greatest challenges or most severe trauma, And yet somehow we continue to be placing people in the most dysfunctional and harmful systems, and we were supposed to be putting them in systems of care, and the only thing that I was seeing was perpetual systems of harm. So anyone in here, and there are quite a few of you that I have worked with that know me on a personal level, there are two things that you know about me. One, I can be incredibly impatient, and two, when something does not make sense, I can be a lot more impatient. So those of us that work in these systems can understand where these traits are not necessarily great, but they have been very much what has been the fuel that has driven my passion and brought me to where I am today. As I work through working in these difficult systems, my last position was working at the Louisville Metro Department of Corrections, and I got to be in a different role where I served as an administrator and in a position where I was able to have bigger system change and leverage to actually make a difference in some of these dysfunctional systems. One of the biggest pieces that I learned working in corrections was the value of community partnership and collaboration with everyone in the community. That if we continue to have an unhealthy community, we're going to see people cycling in and out of these systems that are creating harm. So as I move forward in my new role, I understand that this is not something that I can do alone or one sector can do alone. True progress is going to be coming from all of us working together in an effective way. So with this being a new and evolving role, I'm sure many people are wondering, what is this going to look like and what am I going to be focusing on as the new Executive Director of Behavioral Health? So I wanted to share a few of the things that we've already gotten off the ground working on and some direction where we're going to be going. So the last few weeks has very much involved a lot of sitting down, listening to people, and biggest question that I've had is what is working and where do you need help? So as I drive our city's strategy, I want to understand systems that are not working together well and where we need to collaborate more effectively. I have started to focus on a data-driven approach and making sure that we are collaborating across Metro agencies and sharing that data. I'm assisting with seeking additional grant funding for Metro Corrections to continue enhancing our medication-assisted treatment. We're formalizing partnerships with our healthcare providers to begin early childhood intervention. And we're starting to prioritize mental health education and general suicide prevention. And of course, housing. Housing has been such an incredibly important and prioritized focus in the last few weeks. And I have met so many wonderful partners, and it has been such meaningful and impactful work. And I'm truly blessed and excited to have so many wonderful new friends and colleagues, and there are so many great things to come. So I want to close out by saying, again, I'm incredibly grateful for this opportunity to serve our city. I'm ready to get to work and to start leading with purpose by leading our city through listening and collaboration. This is a monumental milestone for the city of Louisville, and I am so incredibly excited to see the next chapter and the direction that our city will go. So thank you all. Please look at how many folks are in the room to talk about behavioral health and mental health and housing. And this in and of itself is a reflection of how exciting and progressive we are. So thank you, and thank you all.
Thank you so much. Thank you so much, Dr. Lederman. We share the impatience gene, and I think that's why we're going to work so well together, particularly with the work that we have ahead of us. As Dr. Lederman was just talking about, one of the areas where this is going to be able to, we hope, provide support is for individuals who are experiencing homelessness in our community. When someone experiences homelessness, they often come into contact with many of our existing services in our community, and we want to be even better prepared to respond with more behavioral health support, with more housing pathways, and ongoing recovery resources, all in one coordinated way. We know there are many great organizations that are doing important work throughout our community right now. There are different departments of Louisville Metro government that are doing important work right now, and we're looking to tie them more together. For the past 3 years, this is something that we have been focused on in my administration. We all know that we're thousands of units short of affordable housing compared to our city's needs. And the people who need it most are often not getting the shelter, the services, and the support that they need. Our approach has been to tackle problems like this head on, ask the tough questions like Dr. Lederman just talked about, and then implement solutions that are going to work. So our team has been hard at work for 3 years, and I'm proud of the progress that we've made. We prioritize working to eliminate street homelessness for families and youth 18 to 24 and those with significant health care needs, and we've made progress on that goal. We made it a priority to expand our shelters and provide more 24 shelter space, including the recent funding that has benefited new places at Ozanam Inn and the Healing Place. We created the Community Care Campus, which Volunteers of America operates and is in the process of completing right now. We dedicated more than $20 million to create an emergency family shelter, a youth shelter. There'll ultimately be medical respite beds and permanent supportive housing located on that campus. Earlier this week, we opened up the Chancery, 34 permanent supportive housing units there, 4 medical respite beds. Earlier this week, we opened up the great new Prestonian here, not too many blocks away from here. Great new housing, which happens to be affordable for people in our community. Those are just some of the efforts that we've made as we've been on our path. So far, we've already created at 5,000 new units of affordable housing. We know we need to build thousands and thousands more. We've also been working to innovate in this area, including working with MMY on affordable modular homes that are built right here in Louisville by Louisvillians for Louisvillians. And under the leadership of another impatient person, Elizabeth Strojan, Louisville Metro Housing Authority has been replacing unsafe housing with better and safer housing for our seniors, our families, for all of the residents that Louisville Metro Housing Authority serves today and will be serving in the future. LMHA has been under an unprecedented, wonderful period of change since Elizabeth took the helm of that organization, working to improve the lives of residents, working to improve the quality of place that all of them call home, and the quality of place that we'll be able to serve thousands of more residents of homes in the coming years. So please join me in welcoming Executive Director of LMHA, Elizabeth Strojan, to talk a little bit about her work and how that links in to what you just heard from Dr. Lederman. Elizabeth?
Hey, everybody. Good afternoon. Thank you, Mayor. Congratulations, Dr. Lederman. I am so thrilled that Mayor Greenberg had the foresight to create this new position and put such a qualified, caring, tenacious, and yes, impatient leader at the helm. The first time I met Dr. Lederman, who I very lovingly called the jail lady, we immediately got to work mapping out how we could make an impact together. And the Home for Good Task Force, which I think we're going to hear more about today, is a perfect example of how behavioral health and housing must be addressed together. Let me tell you why. The first time I went to Dosker Manor, I thought, wow, we need more permanent supportive housing in Louisville. If you've been following the journey of Dosker Manor over the last 2 years, you've probably heard me say that a big part of the reason that Dosker got the way it got is that many of our residents needed more supports than we were able to give them. For the most vulnerable among us, when we only have the housing piece, but we don't have the services, we're not setting people up for success. And when you only have the services, but there's no permanent, stable home, there's only so much progress we can make. Permanent supportive housing pairs affordable housing with intense case management services to make sure people get what they need to remain stably housed for those facing mental illness, addiction, and other barriers. So why should people care about that? Not you all in this room, we're all on the same page. But even if you don't believe that everyone deserves a safe, decent home, even if you're not bought into the idea that some of us need more supports, then let me tell you how expensive it is to not make these investments. What you get is street homelessness, emergency room visits, and yes, jail stays. Permanent supportive housing is a win-win-win. The people formerly living on the streets win because they're safe and stable. Housing providers like me win because we have properties that are sustainable. And the taxpayers and neighbors win because we're not relying on really expensive systems to solve for an issue that could be addressed at a fraction of the cost. So I am here today actually wearing many hats. As a person, as a mother, and as a citizen of Louisville, I support the Home for Good push for permanent supportive housing because it is the right and decent thing to do. As a landlord to thousands of vulnerable households, I can vouch for the need here in Louisville. And as the largest Section 8 voucher administrator in the state of Kentucky, LMHA is a pretty important partner here because rental assistance is key to making this work. Now, if you're in this room, hey, sweet baby. If you're in this room, you probably know that Section 8 funding is not where we need it to be. We will continue to push for more resources there and think creatively with the smartest housing minds we can find, which includes Ms. Marilyn Harris right here. Yes. But let's not wait until we have enough vouchers at Section 8. Let's get going with the Home for Good push so we can kickstart this effort in partnership with philanthropy. Thank you.
Thank you so much, Elizabeth. And yes, so much more is needed. We need more Section 8 vouchers to serve our community here in Louisville. We need to do more to support those who have been chronically homeless here in our city. And that's what I'm excited to talk about next, what I believe is going to be a transformative new initiative for our community. Working in partnership with the Coalition for Homeless, we've recently been involved in the Home for Good task force to provide permanent supportive housing options for people who have an underlying mental health, or addiction issues that are the root causes of their homelessness. I've asked Dr. Lederman and Marilyn Harris, our senior housing policy advisor, to oversee the expansion of our city's permanent supportive housing initiatives in partnership with this Home for Good task force, the Coalition for the Homeless, and many of the great partners that we have in this room today. This will be the most effective, affordable, and comprehensive response to ending homelessness. And so today, we're reiterating our commitment to ensuring that at least 250 more chronically homeless individuals are placed into permanent supportive housing by 2027. That's right. Now, in order to provide the supportive housing services and the housing itself that we need for 250 individuals, we're going to need millions of dollars to make this happen. We've already provided $500,000 towards this effort. The most recently passed Louisville Metro government budget. I want to thank Councilman Ben Reno Weber, who is here. There's Ben. Thank you very much. Councilman Reno Weber, Councilwoman, is that Betsy Rui? I couldn't see there behind you. Councilwoman Betsy Rui and their 24 other colleagues on Metro Council for their support of this initiative. We know we are going to need to do more. Council members and I will continue to work to provide more funding from Louisville Metro government over the coming years, but we're also asking the community to help as well. We want other donors to step up and join this effort to ending chronic street homelessness. Without proper funding, permanent supportive housing cannot be expanded in the ways that we want across our city. It's critical to aid with rental assistance, case management, mental health and substance use treatment, and various other support services that can help people get a job, stay employed, and have opportunities to prosper and grow throughout their careers and life. So today, we're starting a campaign across the city to help raise awareness for this initiative and to raise more funds from the philanthropic and private communities to help make this happen. We'll be working in partnership with many of the other service providers who are here, other public servants, Commonwealth Attorney Jarena Weathers, Sheriff James, and others who are here with us today as well, business leaders, advocates, and citizens all together to work together to make this a reality. It's going to take a strong partnership Today is evidence that there are many people who are already part of this partnership that have been doing great, important, impactful work for years. Now together, let's work even more closely together with one another towards this common goal. Let's attract others to the effort as well. And now, please join me in welcoming one of those great partners in this effort, Natalie Harris from the Coalition for the Homeless, who's been working on this for years, and we're so excited to partner with as we move forward. Natalie?
So thank you. I'm so excited to see this crowd. I think I have to say that I'm probably the most patient person who's been up here. It's taken years. I came back to Louisville 16 years ago, and the first thing I said was permanent supportive housing. I'm still here standing saying permanent supportive housing, but I just feel so much more energized because there's so many people here also saying permanent supportive housing. I'm excited that Dr. Lederman is one of those and is joining us. And Marilyn has been there long before those 16 years ago. And I'm just excited that we're getting forward to do this work. I'm also thankful that we have a mayor that is willing to come here and to put his energy, not only his energy, but also money and the bringing of people together and other commitments that we will see coming forward in months to come. And not only that, but all the other city staff that are here. We have a huge number of city staff around this room that have been working on this issue and are continuing to do so. And all of that work is to get us toward a goal of ending unsheltered homelessness in this city. We didn't used to have unsheltered homelessness like we do now in this country. And I would love to get back to a time when that was not the case again. And I'm not here to convince you that we need to do that, because I can't imagine that there's anyone, we all have different reasons why we get there, but that there's anyone in this room who does not want to get to a point where we have no one sleeping on the street in this city. So this is our effort. What I am here to say is that it can be done. That's what I want to leave today with. And there are several of you in this room today who last week went to Milwaukee and saw what they've done by coordination, leadership, and targeting of who gets served. And those are all things that this administration has committed to doing in this permanent supportive housing plan. When doing that, they reached 1/10 the number of people sleeping on the streets that we are seeing here in Louisville. So we're going to do it. One thing has already happened. There is a lot of housing that is coming online that was funded in COVID and then afterwards. There's pictures up here of many of those things that are happening. Because of that, we've already added 300 units of permanent supportive housing in our community. And people are moving into those units. We are now at 1,500 units serving 2,000 people in our city. And we need to give some thanks to those people. House of Ruth, Louisville Metro Office of Social Services, LMHA, we know is now a permanent supportive housing provider, Family Health Centers, St. John Center, St. Vincent de Paul, Up for Women, the Veterans Administration, Volunteers of America, and Wellspring. Thanks to all of them for increasing permanent supportive housing in our community by 300 units, and at the same time maintaining a 98% success rate in housing for those folks. And that doesn't even include all the developers and landlords and others that are involved in this. So now what do? We need local people who can help us with funding, with their volunteer work, by getting involved in this effort. We cannot ask the city and developers to do it alone. We need funding that is flexible. An example to give you is that when we use HUD funds to move people into housing, almost all of them have to be chronically homeless, which means they have to stay on the streets for over a year before we can move them into housing. We don't want that anymore. Once somebody ends up on the streets, we want them immediately to be able to get into housing. So if you're energized by this, and if you're energized by the mayor's goal of 250 people by the end of 2027, we ask you to get engaged. We have flyers as you leave here today. Come and talk to any of us, and I look forward to maybe being a little bit more impatient in the future.
Hang around me long enough and that will certainly happen. Yeah, I realize we're talking a lot about permanent supportive housing. I think I've already said this, but just to clarify, I know everyone here with us today knows what permanent supportive housing is, but maybe for some folks that are watching on a live stream or see this later on the media, just to clarify, permanent supportive housing is housing that has additional services for the residents who live in the housing. So for example, if somebody gets this new place to live and they need mental health treatment, if they need addiction treatment services, if they simply need help getting signed up for Medicaid, getting a driver's license, there are trained professionals that help them with whatever their needs are to help them get healthier if necessary, have a new path in life, whatever it might be, to provide them stability and new opportunity. That is the supportive part of permanent supportive housing. It is both housing and services combined together. It can be provided at their home. It could be provided in connection with their being at their place of residence. It can take many different forms, but that is what we're talking about. Providing shelter plus additional services by trained professionals to help get people stable in life and have new opportunity. And one of the reasons we're doing this, as you've heard before from some of my other colleagues, is that there are significant costs if we don't. Costs for individuals' lives, costs for our community. And sometimes the costs can be a revolving door for folks, a cycle that often runs from the streets to a medical facility, through the police department, the jail, and back to the streets. A cycle that none of us want to see, a cycle that all of us are here working to end for our fellow residents around the community. This is about taking care of our neighbors. It's also about making our city safer. And so now I'd like to introduce LMPD Chief Paul Humphrey to share his thoughts about how these initiatives can help our entire community. Chief Humphrey.
Mr. Mayor, this is an absolutely great move. We've worked at LMPD with Dr. Lederman for probably close to a decade now, between developing training, policy, and advisement on how we handle people in mental health crisis. And it's been a great relationship, and I expect that it will continue to grow. The job of policing, when you think about it, is keep people safe. But homelessness and mental health issues are not criminal issues. When people have access to permanent supportive housing and they have access to quality supportive mental health care, they are less likely to end up in crisis that creates a need for a response by the police department. This makes our officers safer, it makes our job safer and more focused, and it makes the service that we provide more effective to the people that we serve. The way that we handle police work has changed significantly over the past several years. Our officers consistently have focused on making sure we understand how to perform in our encounters with people experiencing homelessness and in mental health crisis. LMPD emphasizes behavioral health awareness and ensures officers are equipped properly to respond to these situations. Our officers now have the opportunity to work alongside mental health professionals, social workers, and community organizations that we did not always have access to in order to get the right resources to the right people at the right time. Police cars and jails are not treatment centers. They are not the appropriate place for people in crisis or experiencing homelessness. They are not equipped to provide care for people in need. So our crisis intervention teams help de-escalate situations to keep people out of jail. We are often the first point of contact to connect people with resources and services they so crucially need. This approach helps reduce risk of harm to officers, to the individuals in crisis, and to the public. It lowers the number of people that are involved in an already overly burdened criminal justice system. It frees up resources and strain on the courts, on officers, on detectives, that stem from some of the issues that we find ourselves facing with people with mental health crisis. Our job is to enforce the law. When you look at the Safe Louisville plan, when you look at the LMPD crime plan, it really is about creating opportunities for systemic change to improve this city. And that's what these investments are. They are opportunities for systemic change. They are just the first step in a long journey that we will continue on from here. We all have some version of the American dream, and no one dreams of living on the street. No one dreams of being caught in that cycle of mental health up and down and crises that they find themselves in. We have all had our struggles, but we have all had help along the way to get to where we are today. No matter where we find someone on their journey, it is never too late to push the button to reset where they are and to help them get a new start. It's who we are as police at LMPD, it's who we are as Louisvillians, and it's who we are as Americans. So let's take care of each other and let's continue this work.
Great job. Great ending. So let's do this, Louisville. Let's invest even more in our community and our people to make sure we're building a safer, stronger, and healthier city. We've already started the work. Our Office of Social Services has received funding through Bezos Day One Families Fund to house 7 local families per year over the next 4 years. They'll be able to provide services to help ensure long-term success, like rental assistance, case management, banking, and other financial services. Our city we just recently reallocated money to ensure that the Meals on Wheels program would continue, even after the federal government stopped funding that program. We've invested our opioid settlement funds into behavioral health services, recovery programs, and housing supports. We have seen the success of people working collectively together. So let's keep strengthening those partnerships. Let's keep bringing everyone to the table. Healthcare providers, treatment providers, housing nonprofits, outreach teams, peer support specialists, people with lived experiences all together, collaborating on these important solutions. We've been doing a lot already. Together, I'm excited that we're going to do even more. That's what this initiative is all about. We can show this city, we can show this country that recovery is possible, housing is possible, and community safety is possible. Every person experiencing homelessness is a neighbor of ours, and every person deserves a home for good. Thank you all so much for joining us. But before we leave, we've been talking today about providing support to our fellow neighbors, people who are in need. We've added a little extra here today because as a result of the shutdown in Washington, we're seeing that support is about ready to be yanked from 84,000 Louisvillians, 84,000 people who rely on SNAP benefits to live, to feed themselves and their families. We've already seen federal employees who aren't getting paid. And come November 1st, in just 2 short days, SNAP benefits will end for 84,000 Louisvillians. Healthcare costs are getting ready to rise as well. We know that 1 in 7 people in Louisville already struggle with food access. And the SNAP program keeps people fed and households stable. We've seen the rising cost of groceries and what that has done to households, what that has impacted food assistance. And now this federal government shutdown is moving Louisville, is moving other cities, the entire country backwards in our fight against hunger. And as mayor, this makes me furious. When I see Washington, D.C. and our federal government shut down, I realize we here in Louisville, we have to step up. We have to do everything that we can within our resources, within our power, to help others, particularly when it comes to supporting people who need it the most, to help provide food to families who are in need. Spoke to Governor Beshear earlier today. who's part of a lawsuit hoping that this doesn't happen. We'll find out later today what the initial result of that lawsuit is. I've spoken to Congressman McGarvey, who's fighting the good fight in Washington, working to get the federal government reopened to make sure that healthcare costs don't rise, that SNAP benefits don't run out for Louisvillians. But in case it does, we need to be prepared. And we know that many families have already had to turn to local food pantries. We want to help. Community Ministries here in Louisville recently ran out of food for the first time in 43 years because of the increased demand in our city. We cannot stand by and let this continue without trying to do more. That's not who we are in Louisville. So today we're working quickly every day to see what we can do to help families across the city. So today we're announcing, in partnership with Dare to Care, we're going to have a community food drive at 3 large events that start tonight. We know this is last minute. We're working urgently to try what we can to beat this deadline of November 1st in the event it helps. There are 3 big events coming up over the next couple days in our city, and it provides an opportunity who are attending those events to help out. People often ask how they can help. Yesterday, with LMPD, we showed how people can help make our city safer through our new Connect Louisville program. And today, here's how you can help fight hunger in our community. Here's how you can help families who are in need, who might lose their SNAP benefits in just 2 short days. Tonight, at Boo at the Zoo, at their last night, Saturday morning, we're having a large race, a marathon race on U of L's campus. And Saturday night, back at the zoo for their annual Through the Boot race. We're going to be collecting food for Dare to Care. We're going to be collecting monetary donations for Dare to Care that is going to go directly to help people in need. So before we part today, please join me in welcoming a leader in this effort who is working every day with his colleagues at Dare to Care to help people, to provide support to people in so many ways, to help them provide for their families, the CEO of Dare to Care, Vincent James.
I want to thank Mayor Greenberg for just his heart for the community. You know, when I think about what we're getting ready to face and potentially face, the hundreds of thousands of people across our country that will be without food, no one should ever have to wake up in the morning and ask the question, where am I going to eat? Where am I going to find food? You know, when I think about what's happening today across our community, we're seeing hundreds of people now trying to figure out, how am I going to feed my family? How am I going to feed my little girl? How am I going to feed my son? And we're seeing this real time, and we're hearing these real stories about what's happening in people's lives. And what we're seeing, and also when we think about the critical state in terms of what's happening with regard to food insecurity across our country, we're seeing, you know, for every child that exists, 1 in 5 children in our community is experiencing food insecurity. And one of the interesting things that we also understand is that the SNAP benefits that will potentially be cut, that brings in $16 million a month in SNAP benefits to Jefferson County alone. That's more than Dare to Care's annual budget. There's a huge gap in between our ability to be able to serve the people in our community and to be able to receive the resources necessary to be able to do so. And so one of the things that we recognize in doing so, we're so excited about this food drive because it's really important, and why it's important that the food is distributed through Dare to Care. We have a system of 400 partners that we work with across the community. Many of those partners are here today, and I'm so excited today to have my leadership team, part of my leadership team here. They're right with me, sitting right over here, our Chief Financial Officer, Daniel Frock, who was a former CFO for the city. We're also excited to have Alexis Richardson, our Director of Communications, Jackie Keating, our Chief Development Officer, as well as Stan Sigwald, who is our Chief Strategy Officer. So what we see in the opportunity is really being able to look at this crisis and partner with folks in our community to make a difference. That is the only way that this is going to happen. When we think about mothers who are opening up their pantries and looking to find few canned goods in the pantry, and what are they going to get? How are they going to meet their needs of serving their family? These are our neighbors. These are real people. This is really happening. When we talk about these statistics, behind. 1 in 7 individuals experiencing food insecurity. 1 in 5 children are experiencing food insecurity. These are numbers, but they are neighbors. They are people. And those numbers are real, and we see them every day as we serve our community through our 400 partners. One of the most important reasons that individuals should support the work of Dare to Care is because we have a system that we've built out for over 50 plus years, that we have the ability to be able to distribute food all over the 13 counties we serve. Jefferson County is 65% of the folks that we serve in our community. And so when we think about this expanded pause in critical programs like the SNAP benefits, we also recognize the need for everyone to step up. We're asking all of our partners, we're asking corporate partners, we're asking all multi-sectors to come join us in being able to feed our neighbors and serve our neighbors. One of the ways that you can do this is through over the next several days is to be able to provide food, but also to be able to provide funds. For every dollar that's donated to Dare to Care, we're able to provide 2 meals for our community, 2 meals for individuals in our community. We can maximize that dollar as opposed to trying to identify how we're going to distribute and disperse a canned good that we have to pack, sort, and then put out. We can buy the right kind of food that people want, and we can provide the choice that people need when they are coming for food assistance. So with that, we need our community's help to stand up. So please consider continuing to advocate to our lawmakers for food assistance and swift resolution, to our government. Volunteer your time. We need volunteers to be able to serve our community. And you can also donate through the city's drive so we can purchase and distribute the food that we need. Together, we can make a difference. And this mayor that we have is incredible when it comes to his heart for serving our community. And Mayor, I want to thank you for your vision and your commitment to supporting those who are left out, those who are least thought of, that we can elevate those voices so that they can become those who hear and see and experience this American dream that we all are striving for. So thank you so much, Mayor.
Thank you. Thank you so much, Vincent, and to the entire Dare to Care team. And as Vincent mentioned, we're collecting canned goods at these 3 events, but you do not have to attend any one of these events. You can be anyone across Louisville, across the entire world. Please contribute to Dare to Care. Your funds will go directly to help people who are in need right now and who will be even more in need over the coming days if this federal government shutdown isn't resolved. And even if it is resolved, we know there will still be need because of all the reasons that we've talked about today. So let's continue to come together. Louisville, this is when we shine, when we come together to support each other, to support our neighbors, whether it's with housing, with food, with all of the initiatives that we are working on together. This is a great city. We shine when we come together through these challenges. Thank you for your support of this permanent supportive housing initiative. Thank you for your support of Home for Good. And thank you for your support of Dare to Care. Thanks for joining us here today. And I know this has gone on long, but thank you for taking that effort to help support Dare to Care given the crisis that we are facing. And I think we'll take a couple of questions. If you guys who all spoke want to join me up here, we're happy to take a couple of questions from members of the media before we part, if there are any from you.
Talk about the actual initiative we're here for today. Can I get your comment really quickly on the Yum Brands relocating its headquarters to the PNC Tower next year?
Sure. The question was not related to what we talked about today, but just about an hour ago, we had a great announcement that Yum Brands is moving 550 employees back downtown. 550 employees. Next year, 550 employees will be moving into the PNC Tower, and this is a great sign that downtown is back. All of us that work downtown here every day love it. Our administration has been working hard to bring more employees down here, to build more housing in downtown Louisville, to create more opportunities for fun, for outdoors, for culture, restaurants, for tourists that visit here, and this is a great step in the right direction. So we've been working, Louisville Economic Development Alliance and I have been working very closely with the leadership of Yum to make this happen. It's been tough to stay quiet with a lot of the headlines that have been in the news recently about this, but this is a great result, and I think you'll see more to come from Yum in our community as well. Any questions about permanent supportive housing? We did such a good job explaining it, guys. All right, well, thank you all once again, and we look forward to continue collaborating.